So I just want to start with one question. Rebecca, I'd like to ask you, what about this thing Tom said he thought you were going to talk about, the What Works Clearinghouse standards? Do you think that is a good place to start?
Thank you, because you are now allowing me to say the last few things that I had hoped to say, and I didn't manage my time well. So I saw the red light and I panicked. So I thought I was supposed to be good. Got late to the meeting.
End very abruptly.
So what I have prepared to say is that I really think it's important and useful to think about building on existing standards, and by that I mean, like, the What Works Clearinghouse has one set of standards that are fairly scripted, as Tom suggested. The Campbell collaboration is a little more Catholic in that they want a set of standards before you do a review. They want them to be clear, probably much more like Steve and his group do. But we don't want them changing from place to place, or blueprints. But one of the things I think is important is to think about making the coded data and the decisions that you make, whether they are What Works standards or some variant on that, make those a part of the database as Steve makes a lot of his information available at WISUP. So, I mean, just so that everybody here knows what the What Works standards do, what they do is you start out with review protocol, which can vary a little bit by topic area, so there may be some slight variations, but they do adhere to a very scripted set of standards around what constitutes evidence that they will say meets standards or meets standards with reservation. And they do, as Tom said, have the 4 designs that they currently include. I don't think that is the be-all and end-all. They are, right now, they have an updated set of standards out for public comment and review. They are working on additional standards for additional designs. So I think they would welcome this kind of feedback. It just takes time to get buy-in. What you've got with the What Works standards is a system it's been in operation now for 10 years. And it's actually gaining some traction and some acceptance. People are designing their studies to those standards, and more to the higher end of the standards than the lower end of the standards, because nobody wants to have them with reservations. They're reporting out their studies better. And when a study gets reviewed, there is probably a 6 to 20-page Excel worksheet, much like Hank's worksheet for cost, where the information does get coded, so it does allow you to go down and reuse the data in a different way, to look at subgroups and to look at the specific decisions that went into the process, to separate out outcomes that passed standards and outcomes that didn't pass standards within the same study, for example. So and these data are being shared. You can execute a data sharing agreement. So it is a place to start. They're transparent. They're and I think one could start there and have a policy that said any deviations need to be documented. If you have good reason to deviate, you could stipulate your exceptions. So that would be one suggestion to consider instead of reinventing the wheel. That process took probably 5 years to get the standards at a reasonably stable basis.
I'm interested in you guys all talking about the 4 different stamp of approval mechanisms which Jeanne has measured. So I'm interested in you guys talking about the 4 different stamp of approval systems we have. We just talked about the What Works Clearinghouse is a possible, if you will, model for this workshop to be suggesting. What do people want to say about the fact that we have at least 3 others, and whether one would want to, as part of a workshop, advocate one of the 4? talk more about general standards rather than saying build, for example, on what works clearinghouse. I'm envisioning a food fight among the four. Steve will probably say it wouldn't be a food fight, but I'm just interested in what you think. Jan said he didn't think that any of the stamp of approval systems are going to work. Isn't that what I heard you say?
I think it would be useful for this group. Sorry. I think it would be useful for this group to reflect on. That to me seems like an empirical question, is you can go out and you can see how the policy discussions in the areas that you think are most important are playing out, and the degree to which the stamp of approval mechanisms are constraining claims about evidence in ways that you think are helpful, or not constraining claims about evidence in ways that are useful. I don't know. The areas that, as I say, the area that I work in, it feels like we are I'm now working more in the kind of the youth violence prevention area, and it feels much more of a free-for-all in that area, because maybe that's a particular area where there's an unusual amount of non-overlap between where the different stamp of approval mechanism standards are binding or not. I don't want to speak more generally, but I do think this is an important issue because they are supposed to serve this function, and at least in this one important area, that doesn't seem to work.
Can I have a go at this? You're absolutely right. There are many, many different sets of standards for each of these different compendia of what works, right? And some are more comprehensive than others, and they're never exactly the same. For example, What Works Clearinghouse does not penalize studies because they've been evaluated and implemented by the developer. Steve's system penalizes for that, and if we were in medical research, we would definitely penalize for that. And you could go through a lot of different things. And there's a politics to setting up these compendia too. I know of one Washington agency whose own programs were not faring at all well in compendia that were developed. And so it set about developing its own compendium of effective practices that allowed programs it ran to be certified as exemplary, right? So there is a politics to this too. But I think, just to echo what Becca says, if your group doesn't start from one or two of these and critically appraise them for your own purposes, then you're going to put in a lot of extra legwork that you needn't do by inventing it from scratch.
So I would just add, I think it's really important to start from those and at least know what they are and build out so that you can, so things like adding on additional standards for whether or not the developer was involved, that is noted in the What Works Clear. So that's in the coded document. Yeah. You could pull that up and change how you use it. And so that's one thing I would say, I'd say, and whether you start with the What Works, I say that only because that is the one that has the longest time testing. It is, I think, the most formalized, and I think would be it would be easy to know where you're deviating and to be able to say why. Also, just to know that there is an interagency work group that is including folks from justice and crime and justice and HHS and Department of Education, Department of Labor, that is working to think about whether there should be a common evidence platform where you would actually house all the coded studies and make the information available. Part of that process will also be thinking about how do you deal with the fact that currently standards are a little bit different for one? Do you try to bring the standards together? Do you just have a crosswalk between them? How do you format them, et cetera? The idea is not to say that every single agency needs to be exactly the same, but to know where you differ and why is the idea there. So you might want to plug into that. To that group. I'm more optimistic that there is more commonality, and that differences could be mediated. A lot of the differences are because different people were at the table making the decisions. So it was different contractors who, got the contracts, and no contractor wants to take millions of dollars and do exactly what the other contractor did. So you do something a little different, or you think a little differently. So I would be optimistic about some coming together. I think the field has matured a lot in the last 10 or 15 years.
Yeah, this would certainly be something that if this workshop became a committee would do. The workshop is not in the business of making recommendations. In a way, the workshop becomes, is this a recommendation for doing a committee which would look into some of these issues more closely?
Anirban, it's okay. I have a mic here. I really enjoyed the presentation. I have becoming increasingly concerned about this language about using RCT as a gold standard. And more we have realized that RCTs are not the gold standard. In fact, they are far from the gold standard. Yet all the benefits that you confer or you get from randomization, you tend to kind of assign it to RCTs. But we know that RCTs generally have all sorts of problems, both in the design of the RCTs and then the data that's produced through the RCTs. And in that sense, what I was wondering is that if it would be better, instead of kind of drawing bright lines across these specific study designs, than to give a checklist of identification criteria that you need to meet through any design to get an estimate that is believable or get to a causal estimate. Maybe just wanted to get your thoughts on that.
So, we don't need to relitigate the virtues and demerits of RCTs versus other stuff. But I think the key thing that I wanted to clarify is just the value of the bright lines, wherever you would want to draw it. And I think maybe it's useful to think in concrete terms of what sort of applications we're talking about. So if you're thinking about like the Department of Education is trying to decide how to let school districts use Title I money, and Rebecca Maynard is the person in charge of making those decisions, then a checklist for what sort of evidence that would identify programs that would be legitimate uses of Title I money make a huge amount of sense. But if you're thinking about something like, I'm just going to pick something at random off the, like debates about charter schools, for instance, where it is going to be a very public debate. The idea that some sort of checklist is going to constrain the kind of evidentiary claims that are made in that sort of setting just doesn't strike me as being realistic. I don't know whether something like a What Works clearinghouse would impose any constraints on that sort of debate either, right? But it's just frustrating to pick up a newspaper and see what passes for evidence in these things that are very, very public, very important, very political, so I wouldn't argue against sort of non-bright lines and checklists in some applications, but I think for what this group is thinking about, I think it is useful to also think about these other situations where you need some more, potentially some more constraining process, recognizing there's a trade-off.
Can I throw in my 2 pence here? It is pretty clear that RCTs are not a gold standard if you understand gold standard as infallible, right? I mean, they have their own assumptions, right? It's a great theory in expectation, but not necessarily in your case, right? It does have these assumptions that have to be met, but they're pretty transparent. You can check them in the data. And the case for an RCT is it's relatively superior to the alternatives. And I think that's true if you're interested only in internal validity, because the alternatives, well, Becca said that for me, if you're only interested in internal validity, which you should not be, and my first remarks were to warn you not to be, right? Then if you are interested in it, relative to the alternatives, it is superior, because all the other alternatives, except for regression discontinuity, require full knowledge of the selection process and perfect measurement thereof. And there are ways of getting much closer approximations to that than other ways of doing it, but it's not going to come up to the RCT. So I would get rid of gold standard language, but relative superior, I would have no problem with.
My only response is that the internal validity part is not trivial. The generalizability part is not trivial, and so there is a trade-off, right? You can have something that's extremely reliable, but really far away from what your policy effect should be, and on the basis of which you're making policy, versus taking maybe a slightly biased estimate, but at least it's identifying the parameter that is really should inform policy, and there's a trade-off between that, and I don't know how you would make that trade-off unless you have some explicit set of criterias that say your identification is based on these assumptions and whether these assumptions are met or not.
Can I make a, so I would argue, I think we could probably agree that the term gold standard it just is inflammatory, and we should just get rid of it. Yeah. Okay, so I think the question is, how good is the evidence? I would argue that if you don't have internal validity, you don't have external validity. So I think that that's a false dichotomy. That's not the same as saying that if you have a place-based, that was part of my first set of cautions, is that if you have a study that was done in such a unique place that the results don't have relevance to your setting, then you haven't learned much from that, and you probably shouldn't consider that in your specific benefit-cost analysis. But that doesn't mean that we're better off. I think we have to be careful not to just jump and sort of say, oh, so we're better off if we've got this more representative sample, but we have some unknown degree of bias. I don't think we need to fight about this. I think it's in the application, and that is why I think regardless of how good a study is, whether it's an RCT or some kind of a comparison group method. I mean, RDD studies, for example, they may give you good causal validity, but it's a very different question. Okay, it assumes it's answering the question, what are the impacts at the boundary,
at the local, yeah.
and you have a lot of other assumptions to generalize that to the full range
Right.
population. Now you may meet those conditions, but you may not. So that's not to say it's all good, always good, or always bad. I think we need to be very discerning, and I believe it would be helpful to have some standards that we apply that just sort of tell us where do we need to look to determine whether or not this particular study is relevant or not relevant, meaning good quality and relevant on other dimensions to the particular question that we're looking at.
I would respond in two ways. First of all, as implemented by applied microeconomists since about 1995, who've looked at RD only as a post-test only issue with one group, Beck is absolutely right that causal generalization is limited to the local average treatment effect at the cutoff.
Right.
But as soon as you put in a comparison RD function from pretest or match non-equivalent comparison group, you have the chance for generalization away from the cutoff over all of the area in the assignment variable where the treatment's applied.
Right.
That's still not the same as with the randomized clinical trial, which is the average treatment effect for all values.
That's not true, right? If you believe there's selection into the trial,
Right.
you cannot generalize it. Yeah.
But the second point I'd want to make is that many people say, and I, alas, have written, that internal validity is a necessary condition for external validity. Becker sort of recreated that. I think that's a mistake, because even with a randomized clinical trial, that doesn't guarantee you internal validity, right? In the one case that you look at, right, there may be bias from small selection differences, from small violations of the Sutper condition, from small this, that, and the other. So it is not an unbiased estimate, and even if, except in this one case, it's not necessarily an unbiased inference. And anyway, it would have its confidence intervals around it. So it is not something fixed.
Right.
And so you can satisfy, I mean, Jens was talking about what I call the satisfaction theory of some kind of an inference. You can satisfy and say, this is going to be good enough for me to buy this increase in external validity or this increase in construct validity. But that we don't do because we have sold ourselves this bill of goods that the point estimate from an RCT is unbiased.
Yeah.
It's not from one case study.
I mean, that was my
particular
point
RCT.
exactly, that, you know, there are these problems of RCTs too, and we should be careful in kind of crowning this one design as the best design to produce.
It's still the best among the alternatives. It is the best among the alternatives.
Yeah, so.
And we also don't, I mean, I think if you look, for example, at certainly at the What Works standards, which I know better than the others, but I think the others as well, they look beyond it was an RCT. That's part of these standards, is to not just say, so you flip the coin, you're done. You know, you have to also look at things like the baseline equivalence. You have to look at things like sample retention and equivalence of the analytic samples, et cetera. So, you know, I don't think any of us is suggesting that RCTs are perfect, or that even better than some alternative design in some cases. I think we just, I certainly wouldn't advocate having that argument.
But they never do equivalence tests. They do tests of difference.
I just want to bring up a somewhat different issue. So going back to something like the nurse home visiting program, which we've heard a lot about, you can do an RCT to see whether that intervention is effective. But then, you know, when Steve Voss is trying to use that data and say, well, why do we care about reducing child abuse anyway? Then, you know, he ends up using some of my data from a longitudinal study, and my study would be rejected by all of the clearinghouse, what works type of thing, because it's not an RCT, it's not an RD, it's not any of those things. So I just think that we should have some discussion about how do we value benefits for things like child abuse, where we're never going to do an RCT.
Dick Zerbe, you've been waiting patiently.
Can't we answer that question?
There are, the first mention of cost-benefit or benefit-cost in legal cases in this country occurred in the 1940s. There were two. This decade should produce, in court cases, should produce at least somewhere around 1,400 to 1,500 cases in which cost-benefit is mentioned. The point I'm trying to make is really elaborate on something that Jens was talking about, which was sort of the importance of politics. I think that if you can have part of the question here is when is some standard better than no standard, and if we have a set of standards, even in cases such as charter schools, and they begin to find their way into court cases and so on, that's going to have really an important effect on producing constraints on political decision making. You're not going to, of course, you're not going to get rid of politics, but you can constrain the effect to some extent. That's the statement I'd like to see about how you respond to this. You were shaking your head, Tom.
Oh, forgive me. It was the framing. When you talk about standards and substandards, right? I mean, we have to have an externally warranted theory of satisficing standards, not the best or the perfect, but satisficing standards. Take sort of Herb Simon's language seriously. And what we're trying to do with this literature is to find a set of quasi-experimental practices that satisfies, because they very often reproduce the same results as randomized clinical trials. And because you have this external empirical warrant, you can make a case that they will usually be good enough, right? And we get hung up in perfect standards, or we get hung up in the best standards, but we don't come to grips with satisfying standards.
I agree completely. That's our point.
Right.
So this is a question for Jens in regards to this powering studies for benefit cost analyses versus powering studies for statistical analyses. Specifically, thinking about the last panel and our issues around multiple testing and should we go wide, should we confine it to the original logic model of a program in terms of our outcomes that we're assessing, or should we allow ourselves to revise logic models as it becomes apparent that maybe we didn't have a complete logic model. And so my question is, how does maybe this value-added approach, opposed to simply a statistical significance approach, potentially allow us to navigate the issue of looking at multiple different domains and running multiple different statistical tests versus maybe just the actual total value added of the program?
I'm not sure I have anything smart to say about that question that got raised I'm sure I don't have anything smart to say on that question that was raised at the end of the last panel. But I think the fact that we're having this conversation seems like a big step forward, right? Because right now what I see is a lot of power calculations for policy experiments that are completely disconnected from any question about the cost of the intervention or the social importance of the outcome. It's all about how large the MDE is in effect size terms, which seems, now maybe a bunch of smart people thinking harder about this would conclude that you don't want to power these studies up so that they can always reject a benefit cost ratio of 1. I don't know. But the idea that the power calculation would be totally independent of any consideration of intervention cost and the importance of the outcome just strikes me as being totally crazy. And that seems like something where this group could, I think, do a lot of good in putting that on people's radar screens.
Sure, and I think Dan's got a comment too.
Can you repeat your question again, Janet, please, quickly?
What do we do about things where we're never going to have an RCT?
Right. Well, we have to have methods that a randomista would consider to be inferior. But we have to have methods that have an external warrant, so they're not just my choice, my preference, or not even the preference of my particular guild. Right? Now, where are these external warrants to come from? Since theory is the one we usually rely on, but theory doesn't help here because it's too vague. The statistical theory is if you know the complete selection process that's correlated with the outcome, then you're home and dry. But you don't know the complete selection process, right? So the theoretical warrant won't work. What other warrants are there? Well, we're trying to implement an empirical one here. Now we've learned how to do design replication studies much better than that first generation of labor economists who were really creative, but by current standards, they now look as though they were naive and hadn't really thought through how you do a good within-study comparison. But you've got to have an external warrant from somewhere to create a theory of this is satisficing. And I don't know where you get the external warrant from for passive longitudinal measurement studies, right? Now, some people have suggested there's actually an NAS panel, or NAE panel, looking into this right now. I'm on this group. We met here 2 weeks ago, and it was led by, my nominative dysphasia is horrible. It was led by Adam Gammaren, was the chair of it. and it was joint NAE and IES group, right? And they met in the Keck building. Right? And so I think there was some discussion there about how do you create a warrant for passive descriptive longitudinal studies and causal inferences from them. And it's not easy because unlike in quasi-experimentation where you have an exogenous shock into a system just like in randomized clinical trials, for many of the things you don't have that. You're just measuring it and it's caught up in an endogenous, you know the story, right? So people are thinking about that, but there's no easy answer unless you've been able to locate within the passive descriptive data set some what Campbell called outcroppings where there were changes in the law about adoptions, in the law about this. If you can find those outcroppings in a passive longitudinal data set, then you've got
what economists call natural experiments.
yeah, what you call natural experiments.
But natural experiments are completely rejected by all these stamp of approval. That's right.
But that's going to change. That's going to change.
Yeah. But I thought, so I thought one of the, I thought one of the.
That is groupthink. That's just groupthink.
So I thought one of the interesting things about Janet's, there are many interesting things about Janet's question. One of the interesting things about Janet's question is it raises the question of whether you can think about the effect of the policy on some intermediate clinical endpoint, and then the effect of the intermediate clinical endpoint on some final clinical endpoint. And I think one of the very important questions that Janet's question raises is whether you should think about both of those links exactly the same, the standards of evidence for both of those links the same way. And I don't know the answer to that. And I think one question that I had is how do the medical people do this? I think I can't start, if I start the Jens Pharmaceutical Company, I can't just start selling pills out of the back of my station wagon without doing an RCT, but the medical people must, I don't know the answer to that. How do the medical people deal with this linking of intermediate clinical endpoints to the final?
Models.
What's that?
They build models, they get the causal effect of the surrogate measure, and then they have an epidemiology model making surrogate measure.
So the medical model is to think differently about the two links in the causal chain. Yeah. That seems very interesting to me.
Right.
Yeah.
But what we have started to do more is falsification tests. Sorry. What we've started to do more in terms of external.
What we have started to do more in terms of external reference that Tom was talking about is falsification tests, which have always been there in the economics literature, but in the medical literature hardly existed. Like when you do these, say, obviously for a long time propensity score match was touted as causal influence mechanism and still is, right? But now people are thinking, well, I'm doing this matching, but I know I'm not controlling for all the hidden biases, but let me add some validity to this analysis by doing a falsification test and seeing, does it not show an effect where we do not expect to show it. And those are helpful, I think, in terms of external reference.
I want to give Dan a chance to talk. Give Dan a chance to talk. He got the microphone a while ago, and so let's just.
Yeah, there were. I mean, I think there were about a dozen things here that were provocative that I would like to respond to. I'll go to a couple of them quickly, and then go to one at the very end. First of all, Jens's suggestion about the power calculations is something I've been harping on for years at OMB. I think we do hundreds and hundreds of grossly underpowered evaluations that end up getting, basically the end result really is we shouldn't have spent our time doing that evaluation, but people interpret it as the programs don't work. Becca's discussion of kind of selective reporting of results, I think is actually a much bigger deal when you're doing, you're trying to get a journal article published or get something reported in the New York Times or get something in the, the thumbs up in the What Works Clearinghouse, where a single positive statistically significant result is what you need to kind of clear those hurdles. When you're doing a benefit cost analysis and you're looking at all the effects, so some of those things might end up being negative, and that one positive finding you get might not be for something that's that important, or that that's that beneficial, it's not going to be as big of a deal. So I think benefit cost analysis is a little bit of a disciplining mechanism for that isn't true for the other things. Then the last thing I wanted to kind of respond to was Jens's, somewhat passionate argument about bright lines. And I think bright lines that are pretty high up the scale in terms of designs. And I'm on both sides of the fence on this issue. I think, coming in, I come from somebody who's done a lot of quasi-experiments and felt like, we should be using that kind of evidence in what we do. But when I got to the federal government, I just saw how it's very hard to be persuasive with, non-RCT evidence. It's just hard to persuade people that aren't already kind of on this, that have a slightly different point of view. And so it makes me feel like, RCT evidence or other really strong methods are really important. But then on the other side, I think about the fact that of, all the policies that you can possibly think of that we've kind of studied with research and where we've had a big effect, where the research has had a huge effect on policy, you'd have to argue that the earned income tax credit would have to be, probably one of the highest, up there of all of them. And the evidence for the earned income tax credit is 99% non-RCT evidence that would not pass the What Works Clearinghouse. And so I'm on both sides of the fence on this issue. There's, and it's just, and so it's very difficult. I think it's something we're really going to have to struggle with.
And let me just also clarify, my argument is not that I want to put the bright line idea on the table for consideration. The main point that gets you there is the recognition that it's not going to be people like Tom Cook and Rebecca Maynard who are the exclusive end users for this stuff.
Steve House just came to the world. Solution.
You got that marijuana law.
Can I just speak to the point you made, Dan, about the AITC, which I agree is a huge, big, important
And I might be a little biased in my views on that one there.
But remember that its intellectual antecedents include the New Jersey negative income tax experiment and the 5 replications of that, and their demonstration that the work effects of that were, in essence, close to zero. They worried about other things. But that's part of the intellectual foundation for the ITC, and these were randomized experiments.
Right, and that speaks to the whole idea of thinking much more in terms of whole big bodies of evidence that we sometimes obviously move away from in these discussions.
I'm the moderator, and I'm embarrassed to say I don't know when we're supposed to be done.
David, we have 10 more minutes before we break.
Oh, good.
Oh, good. And I think we're certainly not going to summarize what we've done. So I think we ought to keep going. If there are more issues for this group, can I just I'd like to just
Sorry.
I didn't, that wasn't in my plan. So I just want to be clear. I think there is a need to continue to ferret out the standards that warrants for alternative methods of estimating effectiveness or the benefits. And I know from the sitting inside of the IES that there is there is not a feeling, or there certainly wasn't when I was there, that the job is done with the What Works Clearinghouse. That you start with the highest order and you sort of work down. It gets more challenging as you move away from the cleaner designs to the more messy designs. But I think the issue is just to work through that and come up with some standards that people could agree on, because you do want to have transparency and consistency. I think Steve made that point very clearly, that you don't want to leave it to some backroom operation to decide this study's in and that study's out, and not be able to defend and have people trust that if you're making an error, you're making an error sort of because errors get made, not because you are selecting, preferencing one study over another for reasons that may lead to unintended consequences.
Can I speak to one issue, which is about this notion of satisficing methods rather than perfect or best methods? And it's something that came to my mind as Damon and Steve were talking. As we all know, in looking at cost and looking at benefits, there are multiple sources of uncertainty, right? And one has to try and deal with those sources of uncertainty. Sometimes we bound them. Sometimes we use sort of a point estimate. That's, for instance, we say that the size of the discount I'm going to put in because the developer evaluated his or her own program is X, right? You use an X, and you get your X from Academies or someone, I don't know. But that X itself comes with an uncertainty judgment, right? So you have to make some point estimates here. I'm going to, God damn it, make this number. It's going to come from somewhere. It's not going to come from me, and I'm going to stick it in, right? But I'm not going to bound it, right? But the true scientist, as it were, would bound everything, and it would get out of sight, right? You wouldn't be able to know anything. So you have to make decisions about what to not bound in order to come up with estimates that are within a comprehensible space for a legislator, as it would be for a scientist too. So that's what I think of as good, satisficing practice, right? It's not the best scientific practice, but it's satisfying practice because it acknowledges the problem, takes an estimate from somewhere, hold your breath, hold your nose, and plug it in. Or am I exaggerating?
That's it. You got it. Okay. It takes we run 5,000 case. We run 5,000 case Monte Carlos, and I've made decisions about what to bound and what not to bound, and the model takes several hours to run one. And if you have pressure, have a legislature saying I got to know this by 4:30, you can't run that. So you have to so make those decisions. Yeah.
One thing I wanted to add, Jens, I think your argument for powering the RCTs to think about the cost-benefit analysis is particularly with prevention, as we've been talking about. You're typically affecting multiple outcomes, and so it's not the case that I just expect to change, one outcome, and so I'm going to think about its effect size. And in fact, if it's one of 10 things that maybe I'm going to end up valuing, its effect size could be its 10th as big. So you start to get into the situation where you may be talking about really large samples because even with small effects on multiple outcomes, you could still be passing a benefit cost test.
Yeah, and I think that you could think about doing benefit cost analyses of benefit cost analyses. If you have a really important program and and having a point estimate for 10 different important outcomes, none of which have a star next to it, is going to cause this really important program to be gutted or something. I mean, this is not, the R&D costs to the program costs for a lot of the things that we're talking about are trivial.
Some of our program officials have done that benefit cost analysis. They come to the negative on doing evaluation.
But imagine a thought experiment of doing the preschool program and powering it up to detect an effect of incarceration 20 years later, right? It would be a huge, huge study. Incarceration rates then were much, much lower, et cetera, et cetera. It would have been a huge study, and it may have been so big that it wouldn't have gotten funded.
Well, I'm not sure if I do, but just a couple of thoughts. I think one of the things that's really interesting about what we're discussing is that we're talking about benefit cost analysis of preventive interventions. And that's a really new development in our society in the last 20 or 30 years. If you just recall back to 1980, one of our faculty members did a study of all the experiments. These were randomized controlled trials for the most part that had been done on the prevention of delinquency as of 1980. There had been 9 of them in the United States. None of them had any positive effects on delinquent behavior. In the last 30 years, there's been this proliferation of randomized and quasi-experimental and other kinds of studies trying to show the effects of these things. And now we're in a much different position where we see some programs that have been shown to be effective in pretty rigorous studies, and in fact, as you were saying earlier, have shown to have effects not only on delinquency but also on substance abuse, or also on teen pregnancy, a lot of different things. And that really puts us in a potential place for really changing how we think about a lot of things that we do in government, because most of our government social programs have been organized around the response to a problem instead of organized around how might we prevent that problem. And once we start to understand that there are shared predictors of a number of negative as well as positive outcomes, then it becomes really, I think, possible for us to think about that we don't have to randomly assign child abusers to an intervention or not, but we can actually think about, could we prevent child abuse in the first place? And yes, we need the longitudinal studies to say what would the effect of that be, but we can do the experimental study on people who might be at risk for abusing their children and randomly assign them. So some of the ethical questions that are associated with random assignment in preventive studies are less troublesome than they may be in intervention studies, I think. And so to me, it's a really hopeful time when we start thinking about prevention of these kinds of health and behavior problems. And at the same time, it's very clear to me that when policymakers, as Jeanne said, people are looking for the benefit cost results that support where they started out. And when policymakers are cynical, if that's the right word, about benefit cost analysis, then it's not going to really be a foundation for sound policy. And so this need for standards that we started with in the very beginning discussion that Margaret talked about some simple decisions that we needed to make in the evaluation of communities of care and the benefit cost analysis of communities of care, really will profit from the kinds of discussions that we've been having today, but over a period of time where we might be able to say, well, here are the standards that we think make sense if you're going to include a study in a benefit cost evaluation. And the other point, I think that Dan's point about the file drawer problem can be potentially solved to some degree by benefit cost analyses that are really looking at all the potential outcomes. And if we had a set of expected outcomes that we say, you need to look for these things, you need to measure these things, you're not fishing when you look for these things. We need to know what were the outcomes with regard to all these things, whether they're significant or not, because then we can put those into a benefit cost analysis and answer this question that Jens is talking about. Is there a potential for this to be positive or not? So those are some thoughts.